everyone, and welcome to Keeping Up with Your Health with Dr. Jasmin. I'm Dr. Jasmin Aldridge, and currently I am a family medicine resident, but soon in June, once I graduate, I'll be officially a board-certified family medicine physician. And so I wanted to start this series to discuss things that I want people, women specifically, who are 55 years old and older to know about their health. And so anytime that I do give public information on YouTube or social media, I want to give the disclaimer that it's very important that the things that I discuss here today, if you're curious about it, if you think it relates to you, it's very important that you go and discuss it with your doctor. I'm just talking to you through a camera, and so I don't know your specific family history, your personal history, what specific questions you have even. So all of this is just a general information dissemination that can empower you to go back to your physician or other healthcare provider to discuss what questions you have and what the recommendations are. And so without further ado, I wanted to get into cancer screening, that I'll be using the guidance of the United States Preventive Service Task Force. So that's a governing body that uses evidence-based literature to disseminate the recommended guidelines, and they keep it up to date. So I'll be using that as my guidance for today, but I also wanted you guys to be aware that every medical specialty has its own governing body by which it uses the literature and best practice recommendations from. For example, as a family medicine physician, I use the American Academy of Family Physicians. My colleagues who practice obstetrics and gynecology use ACOG, the American College of Obstetrics and Gynecology. So while there might be very subtle differences in what the recommendations are, there aren't any frank contraindications or disagreements that we have. So with that being said, I just want to kind of read exactly what the recommendations are, and then we'll go from there. So for breast cancer screening, the United States Preventive Service Task Force recommends biennial screening mammography for women aged 50 to 74 years. And so we all know that people recommend that you get a mammogram to screen for any sort of signs of cancer developing in your breast tissue. However, sometimes it's not quite clear at what age that should start. Based on this, we're saying age 50. I know that certain other specialties might mention you can start at the age of 40, but in my research of my review rather of the literature, sometimes starting that early could lead to more concerns, more worries that aren't actually necessary. And so we do recommend starting at age 50. It could cut down on some unnecessary stress and testing when things might ultimately end up being negative, but it always depends on your own family history. And so again, this is one of those things that's very important to discuss with your physician about when is the best time for you. But generally speaking, you can start at age 50. Now, the next thing that they discuss is the timing of it. Biennial means every 2 years. So you can actually get it every 2 years. I know often women are in the habit of getting it annually, but just know that if for whatever reason you didn't get it in a certain year, say, I don't know, like a pandemic might have prevented you from scheduling your annual on time, you could always get it in the subsequent following year. And so that's just something else to be aware of. Next topic is going to be cervical cancer screening. So the USPSTF recommends screening for cervical cancer for women aged 30 to 65 years of age in the 3 following ways. So you can either screen every 3 years with cervical cytology alone, and I'll discuss what that means, or you can screen every 5 years with high-risk human papillomavirus testing alone. Or finally, you could screen every 5 years with the human papillomavirus testing in combination with the cervical cytology, which is also known as co-testing. And so, what did I just say? Basically, there are specific guidelines for this age group. There's different guidelines for women who are younger than 30, but for age 30 to 65, there's 3 ways that you can screen for cervical cancer. And this is the pap smear, right? Every woman knows about the pap smear. I feel like ever since I turned 18, there's been different, reasonings about when to get the pap smear, when not to get the pap smear, and it changes. And so it's important that we stay up to date with the latest recommendations. And so in this case, they are saying that you can get the pap smear, which actually is when the physician or other provider goes into the vagina with the speculum and scrapes some cells from the cervix itself. And those scraped cells are going to go be analyzed in the lab by a pathologist to see if any of those cells look like they're turning cancerous. So that's what the cervical cytology testing is. Cytology meaning looking into the cells. And so they're looking to see if those cells are showing them any signs that it could become cancerous. Now, the human papillomavirus test is just that, testing to see if you currently have that virus. That virus has been linked to causing cervical cancer as well as other cancers, and so that's why that is a part of the screening for cervical cancer. And so I always recommend to my patients to just do the co-testing every 5 years, because I think that it gives me as a clinician the best kind of information and evidence for the next steps. So if one part is negative, one part is positive, what do you do? We have algorithms that we can follow to know which step we should take next. That doesn't mean that you wouldn't have the best next steps if you just did the cytology alone versus the human papillomavirus testing alone. But in my opinion, I just like to have all of the information. And so this is what I recommend for my patients. On that note as well, I did want to mention that we also recommend annual well-woman exams. So it's like, am I contradicting myself? Because I just said you can get this testing done every 5 years, but I also just said we recommend annual well-woman exams. Which one is it, Dr. Jasmin? Well, we do recommend an annual well-woman exam where we just talk about your complete overall health as a woman. There's other things outside of cervical cancer screening that we can discuss, such as your vaginal health, your urinary and bladder health, all of those things that are very unique to women as we age. And so it is important to have an appointment with your physician at least once a year to discuss women-specific issues. And similarly, on that note, we also recommend a pelvic exam every year. So not that we're going to be taking those cervical cells and looking under the microscope every year. That's going to be left to the 3 or 5 year testing. But to just take a general look in the pelvis and see if there's anything that looks abnormal, if there's any symptoms that you're having that you're concerned about, we can assess what the discharge is telling us. Those types of things are very important to do annually. So, moving on to the final topic that I wanted to discuss in this segment, colon cancer screening. So the USPSTF recommends screening for colorectal cancer in all adults aged 50 to 75 years. But recently, in May of 2021, they did also give a recommendation that you can start as early as age 45 to 49. And so again, this is one of those areas where it's important to discuss it with your physician to see what makes the most sense for you based on you and your family history and your other risk factors. And another note when it comes to colon cancer screening is how we screen for colon cancer. So I think a lot of people have heard of a colonoscopy, and if you haven't, let me explain. What it is when a GI specialist or a colorectal surgeon, or even in some areas, family medicine physicians who have been trained in procedures like this, take a flexible rod with a camera on the end of it, and while you're nice and sedated on a procedure table, they take the rod with the camera through the anus to search up and look all throughout the colon to see if there's any abnormalities. For example, if they see little protrusions in the mucosa of the colon, these little protrusions of tissue are called polyps. They'll take the polyp out and then pull it back out, and then they'll have it be sampled and again investigated with pathology to see if it's anything that suggests that cancer might develop. And so depending on what those studies show, you can have a colonoscopy as far as every 10 years or maybe 5 years or sooner, again depending on what that pathology of the polyps show. And so again, we have an algorithm that would let us know if this, then that. Now, I emphasize this because there is also the offering of doing a FIT test. I think maybe many of you have seen a commercial for the Cologuard kit, and that basically is just a fecal immunochemical test, also known as the FIT test, where it assesses for blood in the stool. And so if that is positive, typically what we recommend is to do a colonoscopy. So what I suggest to my patients is just to do the colonoscopy, because if the FIT test is positive, the recommendation is going to be to do a colonoscopy anyway. And on a more practical note, insurance does always cover preventive exams. And so if you initially do the FIT test, the insurance will cover it, but that may mean that they may not cover the subsequent colonoscopy if it's needed, because at that point it doesn't become so much of a screening as much as it is like a diagnostic test. So I always just recommend to go for the colonoscopy. You may not need to do it again for a long time, and insurance will cover it. Any questions about any of that, I'm more than happy to answer so I can clarify the things that I say. But more importantly, I just want to empower you to take this information back to your own healthcare provider so you can discuss it further. So that's all I have for today in terms of recommendations for the cancer screenings, but I hope you'll join me on future segments because I want to discuss bone health, I want to discuss vaccinations, I just want to discuss anything that I think might help you keep up with your health. So thank you for joining in with me today.